Hello, Brady Sanier, engineer, MBA, and investor. And in today's video, we are talking about NTLA starting their phase 3 trial, dosing their phase 3 trial for the first time ever now as we speak, which leads us to an advancement of NTLA 2001. I want to talk about here all of that in this video. So let's jump straight into it. NTLA announces first patient dose in phase 3 magnitude study, they're calling it magnitude, of NTLA 2001 has a single dose CRISPR-based treatment for AATR, right? Which is, of course, a set of disease that is quite paralyzing in a sense. And of course, phase 1, phase 2 for NTLA has garnished amazing data where they sort of played with the dosage level and so on. And of course, phase 3 in any clinical trial is really the most important phase because now you've gotten data from phase 1, phase 2, you've gotten your patients enrolled in the past, you've gotten data from them, you looked at your dosage level, you played around with it, and now you're sort of finalizing and concluding what you're leading with. Obviously, this is a one-time treatment. Obviously, this is in vivo. Obviously, this is using CRISPR. The thing that was never clear for NTLA, of course, and that's obviously part of clinical trials, is what is the dosage level? And of course, that varies, right? If you guys remember, the first dosage was, I don't remember exactly the values, but I know that number 2 dosage, different cohort, it sort of doubled. And then the third one cohort, it actually tripled from the first dosage. So, there's a lot of room, right? There's a spectrum of dosage level. And of course, they finalized that here in this, phase 3. And I saw something really, really interesting in their magnitude study, which is, of course, NTLA 2001 program. Approximately 765 patients, they're going to evaluate the efficiency and safety of 765 patients. That's a lot of patients. I don't think they're going to wait until all of those to submit their FDA approval documents. But, that's pretty promising that they're quite confident they can target about that many patients to study over time of this program. Obviously, this program is going to go for a couple of years still. I remember when CRISPR Therapeutics and Vertex started their phase 3 trial. I think that was over 4 years ago, 3 or 4 years ago. And of course, now we have it approved. I don't think it's going to take 4 years from here on. I do think it's going to take at least a year and a half. I don't see this, getting into the FDA hands to approve or disapprove within the next year. And you got to remember, the FDA is going to take about 8 months, more or less, to approve or disapprove a program once it's submitted, right? So I can't see this program being approved in less than 2 years, to be fair. But, you never know what can happen in this space. These are individuals with, lethal diseases. These are individuals that, these patients, of course, have, this disease is quite not just lethal, it's just, there's no cure for it. We talked about it in the other video where the total cost of ownership, you got to look at that way. What is the alternative, the cost on healthcare system, the cost on resources, and of course the cost on emotional, on families and communities. And now you're looking at a program like this where it's a one-time treatment. It gets rid of that disease, or at least so far we have that data to make that statement. Of course, we're not saying it's curing the disease. We cannot technically say that until, of course, we have the FDA approval in the US anyways. But I think, this is promising. This is great for for NTLA, NTLA Therapeutics, NTLA Therapeutics. It's amazing for them to get the phase 3 started. Phase 3 is a big phase of any clinical trial, as you know, like I mentioned earlier in this video. It's a big, big step for CRISPR landscape. You guys got to remember, this is a single dose in vivo treatment. You go to the liver, you inject something, and that's it. You're done. You don't have to extract the cells of the patient, put it in some lab, do some work, and then reinsert those cells into the patient's body. You don't have to do any of that. That is the beauty of in vivo. That is the promise of in vivo. And of course, so far for NTLA 2001, things have been working out for NTLA. I just am in awe of NTLA. I think everything they've done was perfect. There's going to be a time in the next year or 2 years where they're going to slip. Every company goes through their lows. They have not gone through any sort of low since I've been covering this space, which is quite amazing. I mean, this speaks volume of, John Leonard, CEO of this company, and of course the whole leadership staff. Unfortunately, the stock price has not reflected the success of this company in terms of science, but you can make that argument for just about any genomics biotech company. So I just wanted to cover this in this video, guys. Phase 3 has started for NTLA. Big news. I'm looking forward for the data. I'm looking definitely forward for the data. And we'll see what happens in the following months/year. As always, subscribe if you're not. Like this video, guys. It really does help this channel as you know, puts videos on people's homepage. And let me know in the comments below, what do you guys think about this news? What do you guys think about NTLA? Phase 3 trial started. Are you guys bullish, bearish? Let me know. So most people should be bullish about this program, to be fair, but I'll see you guys in the next video. Thank you so much and have a happy Easter weekend, guys. It is a long weekend for many people. Happy Easter.